MRSA stands for methicillin-resistant Staphylococcus aureus. This is a gram-positive coccus, and underneath the microscope, the appearance looks like a bunch of grapes because you'll see in a minute that it's like stems with little circles attached to it, so it looks like a bunch of grapes. MRSA is an S. aureus that has acquired the methicillin-resistant gene. So here's the picture, and as you can tell, it looks like there's some stems with little circles attached to it that look like grapes. So that's how it gets its name, bunch of grapes. Some history of MRSA. In 1940, penicillin was introduced for the treatment of infections. And in 1942, strains of S. aureus resistant to penicillin were found in hospitals. Not even 2 decades later, 80% of both hospitals and communities acquired S. aureus that were resistant to penicillin. And later, in about 1961, there were reports of methicillin resistant in S. aureus as well. So S. aureus became resistant to penicillin as well as methicillin. And most people think that MRSA is found only in hospitals, but in the late 1990s, MRSA began to be detected in infections that arose outside of the healthcare setting as well. So it's not only in hospitals, but as well as outside of the hospitals. Some cases in the US have occurred in patients who have never been hospitalized. So they've never had to stay in the hospital, they've never had surgery, and it's occurred in them as well. Staphylococcus aureus is often referred to as staph, and this is a very common type of bacterium that is found in about 20 to 30% of healthy individuals. And basically it's found primarily on the skin, and it can also be found in the nasal cavity. Most of these individuals are colonized by the staph bacteria, which means that the bacteria are present but are not causing any diseases. Yes, staph bacteria do usually cause infections, but they can bring about disease if they penetrate or break the skin. While some strains are harmless, others pose serious health problems. So S. aureus infections can be mild, causing skin infections such as boils or lesions. So when someone has MRSA or staph infection, basically it looks like a sore on their arm or leg or wherever they get this infection, and around the area is red and tender, so it'd be pretty sore, but in the middle there's like a center that's white and filled with pus. More serious infections can develop if it enters the bloodstream. So if it's traveling through the bloodstream, it can cause infections, pneumonia if it affects the lungs, and it can spread to other parts of the body such as the lymph nodes. S. aureus is typically spread through contact primarily with the hands, and just coming in contact with the skin is not enough to cause an infection. The cut must go through the skin. The cut must breach the skin like through a cut. So basically if you're cut, you need to be really careful. And most of the time MRSA is acquired through hospital stays, because there are individuals there that have weak immune systems and that have undergone surgery, and they become more susceptible to acquire MRSA. But as I said earlier, not only does it infect people inside of the healthcare system, such as hospitals and stuff like that, but it can also infect people that have never been hospitalized. And the reason that most people that stay in hospitals get this infection is because it can adhere to surfaces due to the presence of cell adhesive molecules located just outside of the bacterial cell wall. So basically it can adhere to surgical instruments, and that's how most people get the infection, or when someone is messing with one of the places that they had surgery, and that's how MRSA is transmitted. The most effective way to stop the spread of MRSA is to practice good hygiene. So basically washing your hands thoroughly after you use the bathroom, pretty much do anything. Washing your hands is very important. showering after you exercise, because staph infection can occur in cavities of your body that acquire sweat. So under your arm, between your toes, behind your legs. So showering after you exercise, soon after you exercise, is very important to stop the spread of the infection. Covering your cuts and scrapes with bandages is really important because you are already cut. So if someone just happens to have this infection, or your infection, or you get infected because of the cut and scrapes. So make sure that if you have cuts and scrapes, you cover them with bandages. No matter what you might think it's not that bad, like the cut's not that bad, but just make sure you cover it up just to be safe. And not sharing personal items. That would include girls not sharing their razors and towels, washcloths, basically anything like that. Trying to not share stuff like that is really important, because someone who might have this infection of MRSA, if they were to shave their legs with the same razor as you do, and they were to cut themselves, or say you had the infection and you shave with that razor and you cut yourself often when you're shaving, it can infect that person as well. So it gets in the bloodstream and they become infected with MRSA. The same goes for men too, not sharing razors or towels, basically keeping all of your stuff to yourself. And I know some people think that that's kind of weird, but just keep everything that's yours to you, because you never know who could have this infection. Some people can also have MRSA and they won't ever know. So just be careful if you use someone else's stuff, because sometimes someone can have MRSA and they wouldn't even know it, and you wouldn't even know it because it doesn't show. And that's all I have on MRSA. So thank you for watching, and you have my permission to share this video.